Certain nutrition and lifestyle strategies, like eating fewer refined carbs and getting moderate exercise, may help increase fertility. Today people often leave plans for pregnancy until later in their adult lives. This is different to previous generations. Women are naturally more fertile in their 20s than their 30s, but women are more often having children when they are aged 30 to 34 years old. Media reports of female celebrities who get pregnant in their 40s or later can lead people to think that getting pregnant later in life is easy. In real life it can be difficult. These are a few natural approaches, including certain eating habits and lifestyle strategies, may help increase fertility. 1. Eat foods rich in antioxidants. Antioxidants may help deactivate free radicals in your body, which can damage both sperm and egg cells. There's weak evidence suggesting antioxidants may improve both female and male fertility. If you want to increase your antioxidant intake, consider adding more fruits, vegetables, nuts, and whole grains to your diet. These foods tend to be higher in antioxidants like vitamin C and E folate. 2. Eat a bigger breakfast. Eating a substantial breakfast may help with female fertility, particularly if you have polycystic ovary syndrome, PCOS, a major cause of infertility. A 2013 study found that eating a larger breakfast may improve some of the hormonal effects of PCOS that affect fertility. 3. Minimize refined carbs. Speaking of carbs, it's not just the amount of carbs that have an impact, but also the type. You may want to pay particular attention to refined carbs. These are found in sugary foods and drinks as well as processed grains, including white pasta, bread, and rice. The body absorbs these carbs very quickly, causing spikes in blood sugar and insulin levels. Refined carbs also have a high glycemic index, GI. The GI tells you whether a carbohydrate-dense food will raise your blood sugar significantly. 4. Managing your weight. Being either overweight or underweight can affect fertility. Women who are either overweight or underweight may not ovulate regularly. Women who are overweight have higher risks of miscarriage and pregnancy complications, such as high blood pressure and diabetes of pregnancy. 5. Pay attention to fiber. Research from 2020 trusted source found that a diet higher in fiber and lower in added sugar may slightly increase female fertility. Some examples of high fiber foods without added sugar include whole grains, fruits, vegetables, beans. If possible, aim for the recommended daily intake of 25 grams of fiber. 6. Smoking. Smoking tobacco, including passive smoking, can decrease both female and male fertility. Smoking cannabis can also have an impact on sperm production. Men who smoke have higher rates of erectile dysfunction, a lower sperm count, lower sperm quality. For women, smoking can affect the transportation of the egg to the uterus, interrupt hormones, affect the blood vessels in the placenta, which can affect baby's growth, increase chances of miscarriage or stillbirth. 7. Avoid high alcohol intake. A systematic review from 2017 found that alcohol consumption can have a negative impact on female fertility. The highest impact was observed in those who drank more than 12.5 grams of alcohol a day. Alcohol can reduce fertility for both men and women. It can increase the time it takes to get pregnant, reduce the quality of a man's sperm, reduce the quality of a woman's eggs. 8. Check your iron levels. A 2023 study found a potential link between low iron and reduced female fertility without a clear cause. If you haven't had blood work done recently, talk with a healthcare professional to determine what your iron levels are. If they're on the lower side, it may help to take an iron supplement. When considering iron supplements or adding more iron to your diet, it may help to prioritize non-heme iron, which comes from plant sources. 9. Consider limiting caffeine. The association between caffeine and fertility isn't very clear. While some experts previously recommended limiting caffeine while trying to conceive, a 2020 review suggests this may not be necessary. However, given the lack of clarity on caffeine's effect on fertility, you may want to limit your daily coffee consumption to 1 or 2 cups or start incorporating coffee alternatives into your routine. 10. Get active. Exercise has many health benefits, including increased fertility. Increasing moderate physical activity has positive effects on both female and male fertility, especially for those with obesity. As with most things, moderation is key. Excessive high-intensity exercise may have a negative effect on female fertility for some people. Talk with a healthcare professional to determine which types of exercise would be most beneficial for you. 11. Take time to relax. Trying to conceive can bring added stress to your life. There's some debate about whether stress affects fertility. However, stress can affect your periods, which may affect your fertility.